Welcome back to A New Me. We are here with one of this area's top plastic surgeons, Dr. David Kung. Welcome, Dr. Kung.
Thank you very much.
Can you please begin by telling us about the advancements in chin augmentation?
Well, chin augmentation has gone through a process where in the past we were using a lot of non-autologous prostheses. That means tissues that were outside of the body, implants, so to speak. I think now the field is now moving back toward a more natural approach to augmenting the chin. That is the use of autologous tissues, which means tissues from a person's own body. The biggest autologous procedure, the site for chin advancement, or the donor site for chin advancement, is actually the chin itself, bone from the chin itself.
So you're basically taking the bone from the chin, for instance, and then realigning it or adding to various parts of one's chin that may be lacking, so we can get that more fullness or roundness or squareness, I should say.
Right, that's basically it. What we're doing now is we're using the patient's own chin and their own bone to structure the lower face so that it is much more symmetrical and falls much more into accepted norms as far as different measurements and proportions.
And how long has this been available?
It's been available for quite some time. However, it's still not as popular as some of the implant techniques. But my feeling is that if you are going to have some kind of augmentation or change to your facial skeleton, it's much nicer to use your own bone. The reason is this: if you use your own bone, when you heal, it is almost as if you were born with that chin. You can't feel any separation between bone and implant per se, and it feels and looks very, very natural.
And how invasive is this procedure?
Well, it does involve some surgery because you do need to free up some of the bone in your chin. But the good news is all the surgery is done on the inside of the mouth. Therefore, no scars on the outside. And that's one of the big pluses of doing this type of procedure. Aside from the fact that it's your own chin. Even after the surgery is done, with the augmentation that's there, it's still you. It's not an artificial piece that was added in. It's still your own bone.
Definitely, and that's rather significant, as you just stated.
A lot of
coming
people
from within your body.
Right, a lot of people feel that way.
Now, I believe you have some before and after pictures to show us. Can you please describe them?
Yes, we do. Now, we have a series of pictures, all of the same patient. This is a very, very nice young lady who, on the left-hand side, you'll see her before picture from a frontal view. And you'll notice some things right away about her facial proportions. That is, if we say that the face is divided into horizontal thirds, you'll notice that the lowest third of her face, that is, the portion that contains the chin and the upper jaw, is quite weak and quite tapered compared to the middle third and the upper third. That gives her a very, very, what's the word, very much like an Andy Gump type of appearance, a weak chin. If you look at her on the right, after her surgery, she's had chin advancement, and you'll see her entire face is now filled out. It's much more symmetric, it's much more ovoid, which is what a normal proportioned face would look like. No longer very, very tapered to a point. And if you look at these next set of pictures, which represent her three-quarter views, again, you'll see exactly what I was trying to point out in the last series. Look at the lower third of her face before her surgery. Very, very weak chin, very, very weak mandible, which is the lower jaw. If you look on the right side, look how in proportion and how straight her lower jaw is in comparison to her upper jaw. She's filled out, and all we've done was move the bone in her lower jaw forward. It's also filled out the middle of her face. That's an unintentional benefit, but very, very noticeable in her. And finally, from the lateral view or from the profile view, again, very, very obvious. Before her surgery, she had a very, what we call, convex shape to her face. Look how the nose just kind of sticks out in the middle of her face. After her surgery, this is what we call a very, very well-proportioned profile. The lower third is in proportion to the middle third, is in proportion to the upper third. And her nose no longer sticks out. We didn't touch her nose, but that's the sign of a well-proportioned profile.
There's quite a difference in those pictures.
Yes, there is, and the patient is quite pleased with the outcome, as I am.
I mean, she literally went from what I see here, from literally no chin to a natural and normal-looking chin after the procedure.
Right, and the best part about it is we used her own bone, all her own natural body's materials. There's nothing foreign in her.
And how long do these procedures typically take?
If a person just has a chin augmentation of the type that we're talking about here, you're looking at between 1 to 2 hours of operating time.
And is there any anesthesia involved?
Oh, surely there is. For this type of procedure, my recommendation is that a person undergo general anesthesia. And the reason is, anytime you're moving bone, there's sometimes a little bit of discomfort. You really don't want to be awake when that happens. Although there have been more and more reports of folks undergoing this type of procedure under local anesthesia and even sedation.
We're now going to meet Christine, who's a patient of Dr. Kung's. Welcome, Christine, to A New Me.
Thank you. It's nice to be here.
Oh, it's nice to have you with us today. Let me ask you right off the bat, what exactly did you have done?
I had my lower jaw advanced and I had my upper jaw leveled.
And why did you decide to have this procedure?
It was actually a recommendation on the part of my orthodontist. I came in to him and asked him to straighten my teeth on the bottom, and he said the only way to really achieve that with the optimal results was to have the jaw surgery.
And what was your recovery time?
I spent about 2 days in the hospital, and then I was home for 2.5 to 3 weeks with my jaw not wired shut, but I had rubber bands to keep my jaw from opening. And then after 2 weeks, half the rubber bands came off, and then after another week, the rest of them came off, and I have slowly worked to build up the opening and the movement in my mouth. I still don't have complete feeling or sensation in my lower lip and lower chin, but that's beginning to come back. It's been about 3.5 months now, and I'm beginning to get some sensation there now.
And how do you feel about the results?
Oh, it's terrific. I love the way I look. All my friends and family think it looks amazing. My teeth are straight. I couldn't have been an easier recovery period, and it was just amazing.
Thank you, Christine, for joining us today.
Thank you.
We're now back with Dr. Kung. That was amazing.
Yes, the outcome of this type of surgery is usually very, very striking.
And obviously, Christine is the one who we just saw in the before and afters a few moments ago, so you had a chance firsthand to see exactly what we're talking about in person, literally.
It's kind of exciting to see what she looked like before her surgery.
Now, what's the normal recovery time involved?
On the average, I think clients should plan on having about 1 to 2 weeks to kind of fully recover from something like this. Again, a lot of that also has to do with recovering from the general anesthesia that one undergoes. But believe it or not, it's really not very painful, and the recovery is not exorbitant.
And who's a typical candidate?
Well, basically anyone who has a deficient lower third of the face. This type of procedure, autologous chin augmentation with a person's own bone, you can move the chin in almost any direction. You can lengthen it, shorten it, change asymmetries, and obviously advance it as we've shown here.
Well, that was very informative. I want to thank you, Dr. Kung, for being a guest today on A New Me.